Hi, as a neurointensivist, I encountered a 27-year-old male who presented with nausea, vomiting, and loose stool since quite a time. But what really caught our attention was his hypersensorium, and he was diagnosed with subacute encephalopathy, likely linked to the severe hyponatremia he had. So we have proceeded to correct his sodium levels, and after correcting his sodium levels, we noticed a sudden dip in his glaucoma score. This was quite alarming, prompting us to perform a CT scan of his head, which was grossly normal. So we thought to dig deeper, and to dig deeper, we proceeded with the MRI of brain. Uh, it's fascinating how quickly things can change, and how each test brings us close to understanding the mystery of the mind. And here's what we have found on the MRI of his brain. Osmotic Demyelination Syndrome, a rare neurological condition most frequently caused by the rapid correction of hyponatremia. Some studies have reported neurological complications in almost 25% of severely hyponatremic patients after rapid correction of sodium. So, how does this happen? Is that brain is able to adapt to a decrease in sodium tonicity by several mechanisms, and in patients with chronic hyponatremia, they have already developed all the compensatory mechanisms involving the solute losses. So, in such scenarios, when we are doing a rapid correction, the brain is unable to recapture the lost osmolytes, which leads to dehydration of brain tissue and subsequent demyelination of white matter. And the points of brain is the most susceptible area for demyelination. So, identifying the classic telltale signs often assist in diagnosing osmotic demyelination syndrome and, of course, guiding with the management strategies also. So, the signs we are talking about here are the piglet sign and the trident sign, which we can see in the MRI. So, the piglet sign refers to the appearance of upper pons in the axial T2 section, where we can find areas of signal changes to be specific abnormal hyperintense signals, and they represent a piglet snout, whereas rest of the piglet features are formed by temporal lobes, ICA, both ICA and fourth ventricle. So when coming to the trident sign, this is another telltale sign where the abnormal T2 hyperintense signals in the pons appear to form like a